Hello, this is our presentation on alterations in cognition and mental health, and it is by Christine, Makenzie, and Jacob. So the system being affected is neurological. And so first we'll present the case. So our patient is a 15-year-old Caucasian male. So he came into the hospital for ingestion of substance, intentional self-harm. So basically, he was found on the floor by his mom in the middle of the night being woken up by a loud noise, and they found him seizing, so they called the EMS, and they came and they reportedly he took a whole bottle of Wellbutrin, about 30 tablets. So when EMS came, and also like initially in the emergency department, he was seizing, so they had to give him Ativan, Keppra, and Valium. He also had to be intubated, so they gave him fentanyl and Versed because of that. He had to get a fluid bolus because he was experiencing lactic acidosis. His EKG showed prolonged QTC and right bundle branch block. And he had a bunch of labs drawn, and they showed elevated white blood cell count, elevated creatinine, but he had a normal BUN and AST and ALT. His troponin and BNP was undetectable, which is good, which means there was no cardiac problems with it. He was experiencing metabolic acidosis with an elevated anion gap, and also he had lactic acidosis. The drug screen on him also came back positive for cannabinoids, phenylcilidine, and amphetamines. So his past medical history, he has a past of 2 prior suicide attempts. His major one was in April of 2020, where he intentionally ingested bleach. And this had a lot of repercussions. It caused an esophageal stricture. He now has dysphagia and GERD because of it. He's had to go in and get multiple dilations and esophageal resection with gastric transposition because of it. So he's a lot of GI issues because of this prior suicide attempt. He also has met with a psychologist, and over the past about 3 months, he stopped taking his prescribed psychiatric medications because he, quote, felt they made no difference. So this is probably a big reason why he ended up attempting suicide again and taking his medications that he was supposed to be taking for his depression and bipolar disorder. So he is, with our presentation, our case study, he is currently in the PICU, intubated, and they're working on making him medically stable. So discussion question number 1, as a nurse receiving a report on the patient, what additional information would you want to know before providing care for him? Okay, so then just some alterations in normal functioning of our patient who is in with a suicide attempt. So because of his past medical history diagnoses of depression and bipolar disorder, this is a major alteration in normal functioning, especially with his neural system and cognition. So I found studies where they showed that these disorders cause dysfunctional brain activity, reduction in gray matter, and abnormal connections throughout the brain, which cause a lot of behavioral changes and obviously led to his suicide attempt. Also, because of this suicide attempt, he is experiencing acute encephalopathy, and this causes mental status changes, but they're usually reversible if you're able to treat the symptoms. And then also he was experiencing status epilepticus, which is just seizures, and this is from his antidepressant overdose, which should be able to be controlled once they treat the problem. So the presenting symptoms that he has with the overdose, there's a lot of changes in vital signs, and often it's an increase in heart rate, decrease in blood pressure, and decrease in respiratory rate. Behavior-wise, especially with being intubated, he has potentially some pain, so making sure to upkeep on the pain medication, and also being sedated. They have to do the ROS scoring on him. Family interaction, so his family was the one that found him, so they might have a lot of feelings of blame and thinking that it was their fault that he did this ultimately. And also the patient could just be ashamed of his actions, or it could be opposite and he could be in regret that he didn't actually successfully kill himself. Neurologically, he has seizures and tremors, so it's important to do the EEG on him to monitor for brain activity. And then also for GI, because of his past suicide attempt with drinking bleach, he is NG tube dependent, and because of his GERD, he could be potentially upsetting his stomach after giving him feed. So just being aware of all of that. So I have in the nursing diagnosis section for this patient, and he has quite a few alterations in a nursing diagnosis, starting with self-harm related to previous suicide attempts, impaired social interaction related to altered perception as evidenced by his bipolar disorder, risk for altered family function related to patient's mental health because his mom did find him on the ground unconscious. So I'm sure that will put a kind of some stress on their family. Spiritual distress related to bipolar disorder as evidenced by his multiple suicide attempts. At risk for chronic low self-esteem related to bipolar disorder. Disturbed thought process related to mental illness. And acute respiratory distress related to overdose of his mental health medication, which would probably be the most acute one. All right, what is the priority nursing diagnosis for this patient? And for some diagnostic information, labs you could expect ordered ABGs to test for metabolic acidosis, which he did have. You'd look for an anion gap, his BMP to test for electrolytes and fluid balance, EKG because the Wellbutrin toxicity can cause a prolonged QT interval, which can lead to torsades and eventually death. And a urine drug screen because it is important to know what other medications he's been taking in case he needs to be treated with something and they interact. Like he was tested positive for stimulants and other stuff. So it's just good to know. And medications, sedatives for the intubation, like fentanyl and Versed, and then anti-seizure meds. Keppra was the big one, fluid boluses, bicarb, anticoagulants for DVT prevention, and he should be started on a new antidepressant or like a combo of antidepressants. And then alterations in the assessment was altered level of consciousness because he was found unconscious and he had seizure activity, which is also not normal. And then how do you assess a patient who is sedated and nonverbal?
Hello. All right, nursing interventions. So we picked four of like the big main problems with this patient. So first off, we have lactic acidosis. Two things we want to do is establish two large bore IVs for fluid resuscitation and placed on telemetry monitoring because electrolytes will be out of whack and possible cardiac. Next, we have seizure activity. For this, we want to make sure they have a clear airway. So if you were to have another seizure again, we want to make sure we lay them flat, turn their head to the side, and suction as needed. And then we also want to document when the seizure began and how long it went. Next, we have acute respiratory failure. For this, the patient is mechanically ventilated, and we're going to do daily chest x-rays to monitor his lungs. And now we have electrolyte imbalance. What we're doing is making the patient MPO, giving D5 normothane with potassium chloride to fix electrolyte imbalance and keep a strict I&O. Some other areas we want to look at as well is psychosocial, keeping the patient one-on-one since he is a suicide risk. And in doing this, we're going to make sure that the room is safe. So ridding the room of all potential safety hazards. So cords, trash bags, anything the patient could potentially hurt themselves or others with. And then as a nurse, we want to just provide a caring and non-judgmental environment with the patient. For cardiovascular, we're going to put them on telemetry monitoring, put in on arterial line for continuous blood pressure monitoring, and obtain baseline EKGs with frequent reassessments. Some other treatments that this patient's getting that have been mentioned before is the patient is mechanically ventilated due to the respiratory distress. He's getting the IV fluids, the correct electrolyte imbalance. DVT prevention since the patient is sedated and will not be moving. So SCDs and Lovenox injections. An indwelling urinary catheter to monitor intake and output. EEG monitoring with IV Keppra to monitor for seizure activity. And fentanyl and the dexmedetomidine for the sedation and pain management. Next, we have outcomes. Some of the predicted outcomes for this patient is the patient will at some point will be extubated and will maintain a pulse ox above 92. The patient will be consulted with psych and begin some type of therapy either with or without family. We want to make sure that he's not having any more seizure activities, so we want EEGs that look normal. And his lab value should return to baseline, especially the creatinine. And then we have to consider his family as well, since this patient is an adolescent. The family is possibly at risk for ineffective coping just from being such a young age and all these suicide attempts. So just being there for the family. The financial burden, the cost of the hospital stay, like what it's gonna, if they have insurance, how much it's gonna cost them out of pocket, how much time will they have to take off work to be there with their child. Education for the patient and all the family about mental illness and the implications of it, and offering resources to the family or getting them connected to people that can get them the things they need, such as staying at the Ronald McDonald House or other forms of counseling. And for our discussion question, what are aspects of discharge planning that must be completed for this patient? And that's our presentation.
Thank you.
You're welcome.
Stop. Wait, and our references. Oh.
And
Oh,
maybe stop the recording.